Hi guys, this is my health equity individual project. I am super excited to share it with you all, but I want to start off by first saying I know you can't see the entire project, so I attached another image a bit below just so that you could see the bottom. There's two pictures and my reflection down there. Um, yeah, I'll start off by defining what health equity means to me. So it's the fair, just, and timely access to quality care for people of all ages, cultures, and communities. And I think every aspect of that definition is really important to my past experiences with health disparities, in shaping my current understanding and my current framework of health equity, and then in driving my future practice as a PA. So, I want to start off by talking about the health disparities that I've experienced before coming to PA school. Two that I wanted to hone in on were having a limited access to care and a lack of social support. I noticed this from working at a family medicine and primary care office in Long Beach Island, New Jersey, in my hometown. And I noticed this was affecting teenagers, young adults, and elderly people. Some of the contributing factors to both of these are first, the geography, so the physical environment in which a person lives. It shapes how close they are to the nearest emergency room, to the nearest urgent care, to the nearest primary care provider or specialty medicine provider. I know for me personally, I live about 40 to 45 minutes away from the nearest hospital on a good day. I live about 40 to 45 minutes away from the nearest mental health provider. And around that same distance to the closest urgent care, a little bit shorter to get to a primary care office. Another contributing factor is just social stigma as a whole. So, in my community, mental health is pretty heavily stigmatized. It's not something that people talk about, it's not something that people want to seek care for. So, having a limited demand for mental health providers affects the availability of the providers as well. There's not as many mental health resources around in the area. And an interesting third contributing factor to having limited access to care and a lack of social support is seasonal economy. So, living in an area in which the main source of income comes from a 3 month window of time, so a summer period of time, creates a sense of heavy stress for people who work long hours during those 3 months. They have job instability any other time of the year, and it mainly impacts the income in which they make in those 3 months, impacts the quality of care they can afford. It affects the medications they can afford. It affects the number of providers they can see. Overall, as we learned, health is wealth, and they're severely interconnected. And so putting all of your wealth into only a 3 month period of time is really stressful. It can affect your mental health, and therefore it can also affect your physical health. Some of the impacts and outcomes of having this limited access to care and lack of social support are higher rates of depression, of substance use, and of suicide. These are three things that are really personal to me. They've affected my family and some of my really close friends. And so I really want to be a provider who has an understanding that the environment in which you live can drive your lifestyle. It can drive your risk for depression. It can drive your risk for alcoholism, for illicit drug use, for suicide attempts. And so that's kind of shaped how I've gotten where I am now to my current understanding of health equity. Currently, the values in which that I hold really important to me are integrity, advocacy, so being a firm advocate for any and all of my patients, consistency, meaning I show up to all of my patient rooms with 100%, with a positive attitude, with my full presence and being in talking to them. I want to be a lifelong learner, so someone who's never stagnant in what they know, who's always taking on new people and new cases to develop. And I put my two last values on the same continent because something that I find really hard is a balance between honesty and empathy. And you always have to be both with your patients. So I'm working on delivering an honest truth, but also delivering that truth empathetically to my patients. So, my health equity approach is to understand the barriers in which my patients face. Do they have limited transportation because they are a teenager who doesn't have their license, because they're a young adult who depends on their bike to get to work, or are they an elderly person who doesn't carry a license anymore? I want to be adaptable and I want to be flexible for my patients. I want to be able to coordinate care. And most importantly, at the very bottom, it says steadfast values. I want to have concrete values that I stick to and I approach every single day that are never shaken. My role as a PA, I see, is bridging the gaps in care. So, addressing mental health, addressing physical health, and just acknowledging the limited access, the lack of social support, knowing how geography is impacting individual people. And I think in doing so, I'll be able to earn the trust of my patients. But it's an ongoing relationship, so always continuing to earn their trust is super important to me. Some of the actions I'll take to do that are through communication, so using the teach back method, asking open ended questions, being an active listener. Another action I'll take is by doing mental health screenings. So, doing anxiety screenings, depression screenings, screening for alcoholism, for drug use, tobacco use. I want my patients to be absolutely sick of filling out questionnaires because of how much I care about them. And then a third thing that's really important to me is community engagement. I live in a really small town, and so no matter where you go, people know your name and they're saying hello. And being a provider in this kind of town, you're someone who people trust and look to. I think it's really important to be able to connect them to the resources as well as being a resource for them myself. So I included these pictures down here. One is of a little fruit in a basket there. That's from a local community garden. Everyone donates or it's free, and you can take fruits and vegetables that were grown by your neighbors. I think that's a really great resource for people who have food instability, just knowing that the people in their neighborhood truly care about them. And then the other picture I included in the back of the car, that's from a food and clothing drive that my friends and I helped organize earlier this year for our local church and just the community as a whole around Thanksgiving time. Then moving more towards my future practice, as I said, I want to go ahead and practice in Long Beach Island, New Jersey, where I've already seen the major health disparities of geographic isolation, how that contributes to loneliness, and then how loneliness contributes to a limited access to care and lack of social support, how all four of those factors kind of are all intertwined and feed into one another. Particularly, loneliness exists in the context of my community. So LBI is a barrier island. I included the picture above, as I talked about before. There's only one bridge. That's the only way on and the only way off. It's heavily dependent on the season for the economy. It's a tourism-driven economy. It's a wealth import community, meaning people earn their money elsewhere and they spend it in LBI. They spend it on vacation. So groceries are super, super expensive. The cost of living is expensive. One of the statistics that I included is that the average home value is about $1.2 million now. And you could see the steep incline from the bars. So it used to not be that high at all. Then the average age is about 62 years old in the community, with only about 2 people per household. And the most interesting statistic to me is in the actual population numbers themselves. So in the summer, there's about 150 to 200,000 people in the community, whereas in the winter, it drops to less than 10,000. So overall, just reflecting on what health equity meant to me, what it means to me going forward. I think that the communities in which we live truly shape our mental health. They shape our physical health. And as a PA, I want to know that any one person, no matter how old they are, no matter their level of income or their culture or where they grew up, can be affected by their access to care, by who they have in their social circle, by where they live, their geography, and their internal feelings of loneliness. So knowing that anyone can be affected by mental health and knowing that this can shape their physical health is really important to my understanding of health equity. So thank you. This was a really fun project to do.